What is a clinical research study? Before people can take a new medicine, studies have to show that this medicine is safe and effective. These studies are called clinical research studies or clinical trials. They are carefully designed by researchers to test how the investigational medicine works in the body, to see if it is effective, and to make sure that it is safe for people to use. In a clinical study, participants are asked to take an investigational medicine that is being tested, while they are carefully followed up by a study doctor and other research professionals. To decide if an investigational medicine is safe and effective, researchers must look at the results of multiple clinical studies. Medical data collected from study participants are analysed to determine if the investigational drug is safe and effective. Results of the clinical studies are presented to regulatory agencies who need to give their authorization before a drug can be prescribed to people by healthcare professionals. Before clinical studies can start, they must be authorized by health authorities and review boards that are responsible for protecting the rights and well-being of study participants. For a pediatric clinical study, a person with the knowledge or experience of medicine in children is involved in the decision as to whether the study is authorized. In a clinical study, participants may also have to do some study-related medical tests and exams before, during, and sometimes at the end of the participation to the study. What is an investigational drug? An investigational drug, also called an experimental drug, is the drug used in a clinical study. The study is intended to demonstrate the safety and effectiveness of the investigational drug and its impact on the relevant disease and/or medical condition. With clinical studies, researchers want to see if the investigational drug is safe and effective, how the investigational drug might be used to treat a particular disease, the appropriate dose of the investigational drug, the potential benefits and risks of taking the investigational drug. What is Pompe disease? Pompe disease is a rare genetic disease. It is sometimes also called acid alpha-glucosidase deficiency or type 2 glycogen storage disease, GSD. Pompe disease occurs when the body does not produce enough of an enzyme called acid alpha-glucosidase, GAA. This GAA enzyme is necessary to break down a big sugar molecule called glycogen into glucose, which the body uses for energy. But if the body is not able to make this enzyme, or if the enzyme does not work properly, then too much glycogen builds up in the body. This damages muscles, causing notable muscle weakness, trouble breathing, and heart problems. Pompe disease symptoms can start in infancy, childhood, adolescence, or adulthood. The infant form of Pompe disease, called infantile onset Pompe disease, or IOPD, is the most severe form of the disease. In IOPD, newborns have symptoms within the first few months of their life. The investigational drug is a new medicine being developed to treat Pompe disease and which will be administered as an intravenous infusion. The investigational drug is currently being tested in a clinical study in patients 6 months old and younger and in 2 patients aged 7 to 12 months who have the infant form of Pompe disease and who have never been treated for this condition. This clinical study will take place in different countries. Why participate in a clinical study? Millions of people take part in clinical studies every year. The reasons why people choose to take part are as unique and varied as the people themselves. Some people decide to take part in a study to help find new treatments, and others to support science. A clinical study may involve an investigational treatment which may be different than the standard treatment available for your child's disease. Whatever your decision, the reasons you decide to take part in a clinical study are yours alone. You should decide if you want your child to take part in the study if qualified, after you have had the opportunity to review information about this study. If your child qualifies and is enrolled in this study, he or she will have regular study-related visits with the study doctor. In this study, your child will receive the investigational drug over a period of 2 years. If you and the study doctor remain in agreement, your child may continue to receive the investigational medication for 2 additional years. Your child may be qualified to take part in the study if he or she is 12 months of age or less and has never been treated for infantile onset Pompe disease, has a diagnosis confirmed by genetic testing of the condition, has cardiomyopathy at the time of diagnosis, has had a blood test to determine his or her GAA enzyme level. It's okay if you don't know if your child could be allowed to take part in the study. The study doctor will check and tell you if your child can be a study participant. If your child qualifies for the study, you will need to visit a study centre every 2 weeks so that your child can receive the investigational medicine and have study-related follow-ups with the study doctor and other health professionals. Also, you should know that you will have the right to stop the participation of your child from the study at any time. Your child should continue to receive regular follow-ups with his or her own doctor and healthcare professionals. If you have any questions or would like more information, please contact the healthcare professional or doctor involved in the study.